Medical toxicology is the specialty of physician specialty in toxicology. Toxicology itself deals with how toxic substances are and different types of substances. By that I'm including things like snake venom, spiders, medications, chemicals, anything. And so we deal with the assessing a patient. We're looking at getting history, doing physical examinations, doing laboratory evaluations, and then trying to put it all together as to what is it causing a problem, treating them, and discussing that obviously with other specialists as necessary. So that's what the specialty is. And there's roughly 300-400 of us in the country. So there's not a humongous amount. In Tennessee we have 3, which is kind of nice compared to some states that don't have any. We're another medical specialty, just like a cardiologist deals with hearts and pulmonologist deals with lungs and so forth. We deal with the effects of toxic substances on the body. And basically anything that's a poison, we take care of. Just about anything can be a poison. A good example that I frequently use is people think, well, water's safe, but lead is not. I say, but water also can be a poison because it's really the amount of anything, including water, that can be a poison. Well, the benefit of having a toxicologist is that we deal with anything that's a poison, and anything can be a poison, whether it's a dust, whether it's a particular chemical, or whatever in this situation. So we can start putting the risk together. I mean, just because you were exposed to a particular chemical or substance doesn't by itself mean it's going to cause a problem, but it has to do with the amount that's getting into your system, whether it be just as a one-time exposure or chronically over days, weeks, months, years, that it can be a problem. So we can start looking at what do we need to do. For the care of some of these kinds of poisons, somebody may need a special type of doc. If it's something that's affecting the lung primarily, they may end up needing a pulmonologist. If it's something that's affecting the kidneys primarily, they may eventually need a kidney doctor. But that depends on if they even get to the point of risk to those particular organs. So the main thing we need to do to start with is what is the risk, what are the substances, and what is it causing, so we can detect if there's any problem. Well, I think there's that potential risk. I mean, everything from at least from a calculation standpoint, what's been measured so far appears that it's going to be a relatively low risk. But what we've been hearing is that they still want to ask a doc, as in a physician, what exactly does this mean to me and my family? And this is the one thing we can do. We can get a history, do a physical exam, do some appropriate testing for the things that that do need to be tested, including some screening things like for lung function, kidney function, etc., so that we can see, is there a problem now or not? If there isn't one, we at least have a baseline, levels, if you will, baseline function of your lungs, your kidneys, etc. And then, if and when we need to do a repeat exam, whether it's myself, one of my partners, their own family doctor, we've got a baseline against which to measure. Well, I mean, we're hoping to at least, help interpret their current medical situation, review their, history as far as any kind of chemical exposures currently, in the past, work-wise or otherwise. Put that in the context with these baseline screenings that we're doing as far as chest x-ray, pulmonary function, blood work, and so forth, to let them know, okay, you look normal, you do not, you need further testing, you do not. I suspect we'll probably pick up some people that may not even know they have some other problem that may not even be related to this, and then we can obviously refer them back to their doctor. Or we may find out that they know they have diabetes or whatever the underlying medical problem might be, but they're maybe a little bit more out of control than they should be, and we can still help them realize that there's other issues and they need to talk to their family doctor on those particular issues.